Hi, I'm Dr. Shilpa and I'm a dentist by profession and an endometriosis advocate by passion. So, what am I going to talk about today? Majority of women have at least undergone 8 to 10 misdiagnoses before actually coming to a final diagnosis of endometriosis. I was also misdiagnosed n number of times before my laparoscopic, you know, surgery showed, or rather the biopsy showed endometriosis. But why does that happen? As we all know, endometriosis is a condition in which endometrium like tissue, not endometrium, mind you, it is endometrium like tissue, grows everywhere, grows outside the uterus, okay, anywhere in the body. Mostly it is commonly, it happens in the reproductive organs near the ovaries and uterus, but it can happen anywhere, right from the lungs to the brain, you name it and it's there. So when the endometrium like tissue happens anywhere else in the body, it bleeds every month like your endometrium does, but it has nowhere to go. And because of that, it causes extreme inflammation and scarring of the tissue. Um, the symptoms of endometriosis are very similar to some of the common conditions, and it takes about 6 to 10 years on an average for a woman to get diagnosed with endometriosis, and that's a long, long time. Um, Generally, where all endometriosis can happen. Endometriosis mostly happens outside the uterus, the fallopian tubes, the ovaries here, the uterosacral ligament, peritoneum, anywhere between the bladder, uterus, and vagina. But it may also affect areas outside the pelvic cavity, including large and small intestines, appendix, diaphragm, lungs, and rectum. Don't forget, as I just said, it can happen anywhere. It is seen in the lungs, it's seen in the heart, it can be seen near the nerve endings, and you name it and it's there. So what happens in endometriosis? What are the main symptoms? Sharp shooting pain, stomach cramps that may occur anytime, and it can actually throw your routine out of completely out of the world. I mean, it can actually leave you thinking about what the hell. There is pain in the lower abdomen during the periods, before the periods, after the periods. Endometriosis can trigger extremely heavy bleeding, clotting, which is extremely inconvenient and painful. Painful sex and pain during use of washroom. Two of the worst symptoms of endometriosis. It can actually leave you, you know, thinking about, do I really want to go to the washroom? Or, it actually starts creating marital discord. You may have fertility issues, not really, not always. Endometriosis does not always cause fertility issues, but there is a possibility. Last but not the least, there's a lot of psychological impact endometriosis causes, because you know there is a lot of pain, and because of which you just cannot plan anything. So your social circle takes a toll, your jobs, you lose relationships, you lose a lot of things. So it actually compromises your psychological functioning. It may compromise your sexuality, mental health, and social relationships. Misinformation and lack of diagnosis, could also lead to, mental problems. So the next question is, what exactly causes endometriosis? Very interestingly, no one knows what causes it. There have been a lot of theories, but no certain theory has proved why endometriosis can happen. A lot of times it's said that um, the baby cells, in the sense the embryonic cells which are there, uh, they develop into endometrial cells during puberty because of increase in estrogen. That is one of the theories which Maybe makes sense. And also, it's said that there is a disorder with your immune system because it's not able to identify the cells which should not be there. So, what all conditions can endometriosis be mistaken for? I will cover two topics today because it is a long topic. So, I will do it in parts. So, the first condition which most of the endometriosis patients are misdiagnosed as is PCOS. I have taken treatment for PCOS for at least 8 years before, actually going through a diagnosis of endometriosis. PCOS affects about 5 to 20% of women of childbearing age. The same study also, it was actually a study that was done, and the same study also found that about 80% of women who are experiencing infertility due to the lack of ovulation have PCOS. PCOS is a condition affecting women that causes irregular menstrual periods due to anovulation, that is, not ovulating every month, and elevated levels of male hormones, that is, androgens. This condition actually may lead to higher risk of developing diabetes, obstructive sleep apnea, and even infertility. PCOS is a health condition caused by imbalance of reproductive hormones. That hormone imbalance creates problems in the ovaries. Ovaries are the organs which makes the egg that's released every month as a part of your menstrual cycle. And when you have PCOS, the egg might not develop the way it should, and it might not be released during the ovulation. And there is also an excess of male hormone, testosterone level also is much higher. The symptoms actually may start at the onset of the periods. Besides infrequent or more prolonged menstrual cycle, the excess androgen levels produced cause, excess facial hair, body hair. If the ovaries are enlarged, they also contain follicles. They may fail to function correctly. So, the primary characteristics of PCOS includes irregular or no periods, high levels of androgen, and cyst in one or both ovaries. Ultrasounds may determine multiple cysts in PCOS, and if you have PCOS, you are likely to have at least two of the conditions that I've just told. It is possible to have PCOS without the ovarian cysts also. What exactly causes PCOS? The first is hormonal imbalance. The high levels of certain hormones like testosterone may contribute to PCOS. Insulin resistance. If your body is unable to effectively utilize the insulin, your insulin levels might be too high, and this makes your ovaries produce more testosterone. Third is inflammation. Excess inflammation can also lead to high levels of male hormones. So what are the classic symptoms of PCOS? The first and foremost symptom is irregular periods. The second is infertility. There is a very high chance of infertility when it comes to PCOS if it's left untreated. The third is unexplained weight gain, which can happen because of insulin resistance. Excessive hair growth on the body, especially the face, upper lip, chin, neck, back, abdomen, chest. The fourth is acne. Hormonal changes can actually affect your skin too, causing oiliness and outbreaks of pimples. Last but not the least, it causes a lot of emotional turmoil. PCOS is often said to trigger depression, anxiety, and other mental illnesses. So, how is it diagnosed? Unlike endometriosis, diagnosing PCOS is a little more simpler because it's non-invasive. A proper history, pelvic examination, physical examination, your blood tests, and ultrasound. Actually, these are what are required to diagnose PCOS. Endometriosis, on the other hand, mostly requires diagnostic laparoscopy. Um, your periods with PCOS is often irregular or missing altogether, whereas in endometriosis, that's not the case. With endometriosis, you can experience severe pain during periods, before periods, after periods, lower backache, or even issues with digestive system. Can you have both endometriosis and PCOS at the same time? Unfortunately, yes. Uh, One condition does not affect the other, but there are multiple symptoms that you're experiencing that overlap and can be the root cause of infertility and pain. Uh, since a lot of times these two are present together, that's the reason mostly PCOS is diagnosed and endometriosis is not. The second very common disorder, which is actually uh, misdiagnosed when you have uh, endometriosis, is bladder disease, bladder diseases and interstitial cystitis. There are a number of bladder issues that can affect a woman, but then the most common ones are um, urinary tract infection. I know everyone would have heard of it. Urinary inconsistence, it is very common with women. Overactive bladder, the frequency of urination is much higher when you have overactive bladder. Interstitial cystitis, or as known as bladder pain syndrome, and bladder cancer. Of all the conditions, when you have endometriosis, it is a lot of times, because of the symptoms, it's a lot of times diagnosed as UTIs, recurrent UTIs, interstitial cystitis, and urinary inconsistence. So, interstitial cystitis is a chronic condition causing bladder pressure, bladder pain, and sometimes pelvic pain. And the pain can range from mild discomfort to severe pain. Uh, Specific signs and symptoms are different from women to women. Every woman has a different, symptom to give, and symptom depends on the type of bladder issue and the severity. But some common symptoms which happen in bladder disorders are bladder leakage, pain or burning sensation during urination, cloudy urine, persistent urge to urinate, urinating frequently in small amounts, frequent urination, that is more than 8 times during the day and more than 2 times at night, urine that smells strong, blood in the urine, pain during sexual intercourse, and pressure or pain in the lower abdomen. But why does it happen that women with endometriosis are often diagnosed as as somebody having bladder diseases? That's because endometriosis of bladder uh, or bowel is extremely common. The cells that normally form in the womb can something similar to that can happen outside the womb and in the bladder or the bowel, or burrow deeper within the walls of the bladder or the bowel. These cells will react in the same way as they would if they were in the uterus. So the blood that becomes trapped in these organs causes pain and it becomes inflamed. It's more common for bowel to get affected than the urinary tract. But the pain experienced can make it difficult to urinate or have bowel movements. If your bladder is affected, then you may experience overactive bladder, where you have the feeling of urgency or frequency as well as pain during urination. If your bowel is affected, you may experience episodes of diarrhea and constipation plus uncomfortable bloating. Hence, the symptoms of urinary diseases and endometriosis may overlap. And that's the reason oft it's confused. So, how is a bladder disease diagnosed? A good medical history, bladder diary, pelvic examination, urine test so that it is analyzed for urinary tract infection. Cystoscopy, in which your doctor inserts a thin tube with a camera through the urethra showing the lining of your bladder. Biopsy, urine cytology to rule out cancer, and there is something called as potassium sensitivity test. In this, your doctor places two solutions, water and potassium chloride, in your bladder at one time. You are asked to rate on the scale of 0 to 5 the pain and urgency you feel after each solution is instilled. If you feel noticeably more pain or urgency with potassium solution than the water, then your doctor may diagnose you as interstitial cystitis or bladder disease. People with normal bladders don't have a difference whether it is water or potassium. So these are two main conditions with which endometriosis is confused. Sorry. I will come back with more conditions in the coming videos. Until then, stay safe and please follow our page for updates on endometriosis awareness. I'm here to create awareness as much as possible so that more people know about endometriosis and this silent condition is not silent anymore. Thank you and stay safe. Bye bye.